Water seal drainage system's bottle should be kept A. At the head of the bed at any level. B. Below the chest level. C. At the level of chest. D. Above the chest level. And the correct answer is B. Below the chest level. Water seal drainage bottle or apparatus of closed chest drainage should be kept below the chest level because the raising of level of apparatus above the chest may cause backflow of fluid or air into the pleural cavity. How do you know that intercostal drainage tube is functioning? A. No bubbling in drainage bottle. B. Continuous bubbling in water seal bottle. C. Continuous bubbling from suction tube. D. Oscillation of water column in the drainage bottle. And the correct answer is D. Oscillation of water column in drainage bottle. Oscillation of water column in drainage tubing is moving of fluid up during inspiration and moving down during expiration. It indicates that intercostal drainage tube is functioning well. Continuous bubbling indicates air leakage in system and no bubbling indicates blockage in the system, and this is abnormal condition. Intermittent bubbling is normal and it indicates good working condition of the water seal drainage. While assessing the function of a chest drainage system, the nurse identifies that the water in the underwater seal tube is not moving. What initial action should the nurse take? A. Record patient's vital sign immediately. B. Turn the patient to the unaffected side. C. Check the tube to ensure that it is not kinked. D. Inform the physician. And the correct answer is C. Check the tube to ensure that it is not kinked. Continuous bubbling in water seal chest drainage is considered as A. Normal findings. B. Surgical emphysema. C. Chest drain is out. D. Air leakage in system. And the correct answer is D. Air leakage in system. If a chest drainage system line is broken or interrupted, the nurse's first course of action should be A. Document the findings. B. Notify the physician. C. Check the patient's vital signs. D. Clamp the tube immediately. And the correct answer is D. Clamp the tube immediately. A nurse assisting a physician with the removal of the chest tube, the nurse most appropriately instruct the client to A. Stay very still. B. Inhale and exhale quickly. C. Exhale as the tube is pulled out. D. Perform Valsava's maneuver. And the correct answer is D. Perform Valsava's maneuver. During the removing of the chest tube, the client is asked to take deep breath and hold it. This maneuver causes increased intrathoracic pressure and it helps to drain out the collected thoracic blood. Which instructions should the nurse give a patient who is going to have a chest tube removed? A. Hyperventilate before the tube is removed. B. Take a deep breath and hold it. C. Inhale as the tube being pulled out. D. Avoid the Valsava maneuver. And the correct answer is B. Take a deep breath and hold it. The nurse can best prevent foot drop for the bedridden client by the use of A. Traction. B. Splint. C. Cradle. D. Railing. And the correct answer is B. Splint. Foot drop can be prevented by use of footboard, footrest or splint. This device is to maintain the position of the foot at correct angle with the leg. To prevent foot drop in leg with a cast, which of the following intervention is appropriate? A. Encourage the bed rest. B. Support the foot with 45 of flexion. C. Support the foot with 90 of flexion. D. Use stockings on foot. And the correct answer is C. Support the foot with 90 of flexion. T bandage used for A. Increased venous return to the heart. B. Support limbs. C. Support the abdominal dressing. D. Support the perineal dressing. And the correct answer is D. Support the perineal dressing. A bandage shaped like letter T used for the perineum support. It is also called buttocks bandage or T binder. In lumbar puncture, needle must be inserted into A. Subarachnoid space, B. Sinuses, C. Bone, D. None of them. And the correct answer is A. Subarachnoid space. A lumbar puncture is the entry of needle into the subarachnoid space of the meningeal sac below the end of spinal cord.